The current shortage of blood in the country has now left hundreds, perhaps thousands of patients in dire need of blood transfusion staring at death, with the worst hit being expectant mothers who are due, and also patients living with anemia and those scheduled for major surgeries, among others. Experts say the country lacks proper policies to ensure a sustainable supply and address shortage of blood to facilitate transfusion.
In my constituency, which is Ndewa, I'm losing a lot of mothers. The mortality rate for mothers is so high, as well as children, because we depend on one regional center, which is Kisumu, far away, over 30 miles.
Out of 24 cases in the last 6 months of postpartum hemorrhage in Coast General Teaching and Referral Hospital, we lost 6 because of lack of blood.
Whereas the availability of safe blood and blood products are a prerequisite for various healthcare services, the country is still grappling with low blood units collected annually. Last year alone, the Ministry of Health says the Kenya National Blood Transfusion Services collected 164,275 units of blood, which is below the recommended annual target of at least 1 million units by the World Health Organization.
Traditionally, we know that in the school holidays, blood collection plummets by about 20%. So you're putting this on top of the situation where already you have a blood service that's not even collecting any blood. So we are talking about 0% of blood coming from the blood bank, and maybe now to resort to hospitals doing their own blood collections, which we know is not a safe source of blood.
Collecting and making sure it's safely given to a patient is quite an expensive procedure.
This shortage has been compounded by Kenyans' fear to donate blood, lack of proper mechanisms of blood mobilization and sensitization, and also lack of goodwill from the government, among others. However, should the proposed blood transfusion bill be passed as law, experts say it will provide a robust legislative and regulatory framework that will strengthen the current structures to facilitate a steady supply of blood in the country. Kenya National Blood Transfusion Services is currently servicing over 500 transfusing hospitals nationally with blood and blood components. It is also working with stakeholders to address blood shortage and ensure sustainable supply of safe and adequate blood for transfusion. Gloria, Milimu, K24.